Hello, great one. Have you ever thought of fatality of stroke and blood pressure? Come with me as I break down how blood pressure is controlled and managed for both types of stroke, that is, ischemic stroke and hemorrhagic stroke, and why doctors sometimes don't lower blood pressure immediately. Many people believe that once blood pressure is high during a stroke, it must be lowered immediately. But surprisingly, that's not always the case. A stroke happens in two major ways. That is, a blocked vessel, which results in ischemic stroke, and also a burst vessel, which results in hemorrhagic stroke. So, note that blood pressure is managed differently in each case. Now, let's talk about ischemic stroke, which results from a blocked blood vessel. In this type of stroke, part of the brain is not getting enough blood and oxygen. To help keep the surrounding brain tissue alive, the body naturally increases blood pressure to push more blood towards the brain. This means lowering the blood pressure too fast can worsen the stroke. But if the patient is receiving clot-dissolving medications, doctors carefully lower the blood pressure to safe levels first to reduce the risk of bleeding. But if the patient is not receiving any clot-dissolving medications, doctors may allow the BP to remain high temporarily unless it becomes dangerously elevated. Let's talk about hemorrhagic stroke. This is very different. In this type of stroke, there is a burst blood vessel. As a result, high blood pressure can force even more blood into the brain, thereby worsening the bleeding and increasing pressure in the skull. So in this situation, doctors work quickly to lower the blood pressure carefully and aggressively. Now, for the long-term prevention of a stroke. After recovery, controlling blood pressure is one of the most important ways of preventing another stroke. For many stroke survivors, the target blood pressure is usually less than or below 130/80 millimeters of mercury. Drug treatments often include diuretics, angiotensin-converting enzyme inhibitors, that is, the ACE inhibitors, angiotensin receptor blockers, simply put the ARBs, and also calcium channel blockers. But note that medications alone are not enough. So, healthy eating, reduced salt intake, regular exercise, stress control, avoid smoking, and regular BP checking are all important. But most importantly, never attempt to aggressively lower someone's blood pressure during a suspected stroke at home without medical guidance. Use the cardiac alert app to call emergency services immediately. Know that early treatment saves brain cells and saves lives as well. This empowerment is powered by Cardiac Alert by Tina Health Initiative. Prevent today and live tomorrow.